What are we really doing when checking the hearing of a newborn in the hospital? Your baby isn't going to raise their hand to the sound of a beep. So let's talk about what we do for hearing screens in the hospital, and afterwards I'll share with you why passing a hearing screen isn't the end of the story. The two-step hearing program is what most countries use when trying to figure out what your baby can hear. What are these two steps? Step one is called OAE, or otoacoustic emissions. I don't like these big words. Step two is called BEAR, not the grizzly bear, but brainstem auditory evoked response. Let's make this simple and fun. The first test that most babies get in the hospital is called OAE, and it's performed because A, it's simple, B, it's inexpensive, and C, almost anyone can do this test with very minimal training. A headphone is placed on the baby's ear, sound is sent to the inner ear, the hair cells move, and then the microphone on the ear picks up that sound. All it takes is a quiet baby, a quiet room, and about 2 minutes per ear. But this test isn't perfect. A small ear, a plugged ear from a little wax, or a very squiggly baby can make this test very difficult. I was told as a baby that I never stayed still. If your baby doesn't pass this test, was it because of a plugged ear, or do we really have a hearing problem? That is where step two comes into play. The brainstem auditory evoked response, or BEAR test, sometimes called ABR, they keep changing the name of it, is a much better test, but it's much more sophisticated and requires a skilled person to do. Basically, you're putting an electrode on the baby's head and then sending a sound into the ear, and then the electrode on the head picks up any sound that's going on. So we're actually registering what's going on with the brain. By doing this, it's much more precise. So why exactly is the BEAR test better? Well, one of the problems with the first test, or the OAE, is that when we put a sound into the ear, those hair cells move, but we really don't know what those hair cells are doing other than moving. Is your baby actually hearing something? This is how I like to think about it. So if you turn on a light switch, ideally the light will go on. But with this test, all you really know is that the light switch is working. You don't really know that just because you move the light switch, the light is going on. It's the same with the OAE. You put in a sound, the hair cells in the middle, in the inner ear move. But are they working? Are they sending a signal to the brain? Who really knows? With the BEAR test, you're actually detecting brain activity to sound. That is a much better indication that your baby can actually hear. But there are limitations, and even to the BEAR test, because primarily hearing isn't like a light switch. It's not on or off. It's more like a dimmer switch. And if you have mild hearing loss, these tests are not necessarily going to pick it up. Also, we may develop hearing problems later in life. Knowing risk factors that can lead to hearing loss can help you detect problems later in life. But that's a subject for another video. Love your shares, love your likes. I'm sorry, did you say something? I can't hear you.